The U.S. system has more competition than any other healthcare system in the world. And so the paradox for me and for Mike as we study strategy and innovation is, why is it that competition in healthcare doesn't work like it does in other sectors? In other sectors you see competition and innovation driving phenomenal improvements in quality and efficiency simultaneously, and yet we see in healthcare high costs, variable quality, high numbers of errors, millions of uninsured. How? Why is this happening this way, and how can you change it? What we come to understand is that competition occurs on the wrong things and at the wrong levels. You need competition to occur where value is created for patients. And so competition needs to occur at the level of patients' medical conditions, because that's where value is created for patients, and that's how care needs to be organized.
Can you give me an example, Elizabeth? You can. Would you give me an example of how competition is focused on something wrong?
When you think about the right level, the level at which value is created for patients, we call that the medical condition level, but we don't define that the way a medical school would or the way a hospital normally does. A medical condition from a patient's perspective is a set of interrelated medical circumstances that are best treated in an integrated way. And so from a medical school perspective, that might include multiple medical conditions. But if I have diabetes and hypertension, which thankfully I don't, but if I had diabetes and hypertension, from my perspective, that would be my medical condition.
This excerpt is brought to you by the Massachusetts School of Law, the leader of reform in legal education and a leader in multimedia education for the public. To view the full interview and for a full listing of MSL's programs, log on to mslaw.edu.